The similarities and differences between bronchitis and the common cold. Both are respiratory infections caused by viruses, but bronchitis affects the lower respiratory tract while the common cold affects the upper. Symptoms like cough, runny nose, and congestion are common to both, but bronchitis often involves chest congestion, wheezing, and a productive cough. Risk factors for bronchitis include older age, young children, smoking, and underlying health conditions. Anyone can catch a cold, but children and those with weakened immune systems are more susceptible. While mild cases of bronchitis and the common cold can be treated at home with rest, fluids, and over-the-counter medications, persistent or worsening symptoms may require medical attention. Prevention primarily involves avoiding germs through hand washing and avoiding touching your face.